Next, we're going to look at the Neuroflex Restorative Flex Elbow. These come in sizes from babies on up. Always remember when you're deciding what size, the length of the elbows and the knees are much more important than the circumference. Again, it's not orthopedic. The sizes of the circumference are very forgiving. The length is what you need. You need that leverage to be able to do the fishing pole technology to allow the patient to work through their tone and relax. Otherwise, if it's too short, one thing, you might get a pressure area if they're pulling very hard, but the other is the longer, the more you have a fulcrum that will allow you better leverage to deal with that tone and shortened tissue. With each splint that we make, you get instructions. You can also go on our website. We'll send you DVDs. We're happy to do that with all the videos, but they're on the website. You just go to www.restorativemedical.com. You choose products, and then when you pick your individual product, at the bottom of that page, if there are videos, they'll be there. It might be putting the padding back on after laundry. It might be measuring, it might be fitting, it might be heat molding. So whatever we felt was appropriate for that individual splint is what we did videos for. And we can always send you others if there's some specific thing that you need. But the written instructions are pretty specific. You have photographs that show the stages of dawning, and you have basically, I'm a nurse, so it's kind of a nursing care plan for that device. It tells you why you're using it, what symptoms it's meant to address. Now, this is a medium. It comes in small, medium, and large for adults, and large is typically for a man. I am 5'7", 5'7.5", and the medium elbow fits me perfectly. What you want to do when you prepare your splint to be fit, always put the Velcro back on a spot to keep it from grabbing and snatching. Now, I'm going to put this on my elbow. I'm right-handed, so it's easier for me to demonstrate on the left. If you'll notice, the label is always on the top cuff. So the larger cuff would be at the top, the same on the knee. The top cuff would be the thigh, and it would have the label. A hinge joint is a hinge joint. The elbow and the knee we can talk about together. The label will be towards you when you put the device on. So remember that, because the cuffs need to push here, here, and then the elbow cap tugs here. That way you have your 3-point leverage as if you're doing range of motion. It's very simple. It's really easy. It just makes common sense. We want to change the cuff strap so it's going from the top out, not the top in. It's very hard to get straps in when you have tight shoulders or the forearm is up against the body, and it's also more comfortable for them. So the elbow splints and the knees are both right or left. You very simply open the padding on the elbow cuff and you slide out the cuff strap. You close it, you go to the opposite side, you open it, see the slot with the Velcro up and the strap away from the splint. You're simply going to slide it through and Velcro it back. Now this allows you to very easily adjust the length of the strap. If you need a little bit longer strap, you would Velcro it longer. If it's a little longer than you want, you can pull it this section up and it makes the strap a little shorter, so you have a very nice fit. Then you smooth that padding back down. Do the same on the bottom cuff. You're going to open up your Velcro, smooth this down, open the opposite side. With Velcro up, strap away from the splint. Excuse me. Slide it through the slot and smooth it down, and then smooth your padding back down with the strap straight out. All right, next I'm going to take again the inside of the elbow cap straps off, and I'm just going to stick them together, and that kind of stiffens them up a little. I'll put it through the opening and just stick them back there out of the way. Now we're going to prepare it to fit your patient. Unless you can comfortably take them to almost full range, you're going to adjust the hinge. You never want to overstretch them. It might seem like you should go for the gusto and stretch them as much as you can, but you don't want to do that. You want to allow for them. The whole process is to in the beginning, work through tone to reach relaxation. Then if there's any shortened tissue, then that prolonged low-load passive stretch will, over a period of time, begin to prepare the muscle to be re-lengthened, but you don't want to rush it. So, and you can do these on patients, if you can get them to even 120, sometimes 130 degrees lost range of motion. If they're here and you can get them to here, you can begin to put this splint on. You may have to be a little creative with how long the elbow cap is. But all you want to do is start them opening up. You want to get airflow to this antecubital spot. If you open the elbow up and you have a wound here, something that needs addressing, this opening will allow you to put the dressing on, and there will be no pressure and there'll be good airflow. So we're going to open the hinges, all you do is unscrew the knobs. Each tooth, excuse me, on the hinge is about 5 degrees. So you open those up. Don't worry about measuring the degree of the splint. Again, you are not doing orthopedic. In orthopedic, you're going to measure the splint, you're going to measure the patient, and you're going to make them match. With restorative, you want to feel the patient. You want to feel how the stretch is making their muscle and ligaments and tendons feel. You want to keep it comfortable and just provide that low load stretch. Now I do want you to measure and write down the goniometry measurement of the elbow when you begin to work with them, because in 2 months when they come back in and you're ready to reset the device, you want to measure again to see how, document your progress. You want to document all this. There are several ways to fit this, and different people discover their own way, how they're more comfortable. You can either hold it up to the arm while you've stretched it out and look at the degree, tighten it down, then put it on, especially if your patient is very spastic. But with a lot of patients, you can simply bring it on loose. So you just slide it on. You're going to bring the elbow cap around. Now you can unhook it from either side. If they're real tight, I would unhook this side. But you bring it through and you stick one side, then you separate the other. This is where I may need 2 hands. There. It's good Velcro. And I'll stick it down here. And you'll notice we sew on heavy duty loop anywhere we anticipate that Velcro hook is going to be repeatedly placed. All right, now I'm going to, and the nice thing about this, you see I'm doing it with one hand. If you have a patient that, let's say they had a right-sided stroke or brain injury, the left side is affected and contracted, but they still have good use of their dominant hand, they may certainly be able to don and doff this on their own. Certainly they might be able to take it off, because that's really simple. I'll show you how to do that. But if they can put it on themselves, what independence that is. It's one more thing that they can do for themselves. Okay, now we're going to open up until you feel that when you touch it, you can feel that piano wire, that guitar string pop up. And you want that tight, but you don't want to overstretch it because you run the risk of kicking in the stretch reflex and rebounding back and harming the patient or causing them needless pain. Okay, you can, if you want, dial in 5 to 10 more degrees. I'd be careful with 15. My rule of thumb is, with any patient, until they prove me wrong, the way I'm going to start out will be the higher the spasticity, the greater the tone, the slower I'm going to go. Okay, look at your hinges and make sure they're the same degree. Then you're going to tuck the padding in. This one is important because if they pull their arm against their chest, you want that pad there. Then, if you need to, adjust the elbow cap to where it's even on the back. Feel and make sure there's no pressure. There typically isn't here, but you want to watch this. If they have a lot of fatty tissue, some issue there, you may need to double pad this. And we can always do elbow caps and knee caps that have a kind of a gel in them. So please feel free to ask for that if you'd like. Now your patient can work through the neurological tone. 15-20 minutes of this. And you may not actually see them do that. It may just appear tight, but you should come back in 5 to 10 minutes and be able to palpate, touch that piano wire guitar string, and it should be softening. So you know you have the right amount of stretch. You want to stretch, but you want a low load stretch because you want it over a prolonged period of time. Now, if you want, excuse me just a minute, if you have a hand that is pronated or supinated, you can put the hand splint on, put the elbow over it. Let me demonstrate real quickly. I can put it on myself quicker. There's plenty of room to put this on over the elbow over the hand, because you see where the plastic is of the hand splint is on the bottom, and you only have padding from the elbow there. So your hand is, let's say it's pronated. You can order this strap. Just say you want a strap to attach the hand splint to the elbow to correct pronation or supination. Hook it wherever it seems appropriate, and then tug it and hook it to the bottom of the elbow. That way you can gradually begin to bring that hand around very nicely. If it is supinating, then you would do the opposite. You would hook your strap here and bring the hand this way. Just continually to hook it a little farther and farther, and that will align your hand very nicely. We don't attach hands to elbows permanently because our patients move, and we encourage that movement. It's not like an orthopedic hand, an elbow that we're going to hold in a specific plane. We want to, the reason they're getting the splint is because they have lost range, they have tone, they have shortened tissue. So that's what we're trying to achieve, and you want to be able to have that flexibility of allowing to move inside the other. So this would be the Neuroflex Restorative Flex Elbow, and I've also shown you how to attach one of our hand splints with a strap to correct pronation or supination of the hand, the lower arm.